patient can die in a hospital even when the medication is correct. Not because the nurse didn't know what to do, but because the nurse didn't communicate correctly. I'm a nurse, and today I'm going to show you the types of communication used in nursing. The one style every nurse must master, and the communication mistakes that silently cause medical errors every day. Stay till the end, because one of these styles can literally save a life. In nursing, communication is not a soft skill. It is a clinical skill, just like giving injections or monitoring vital signs. Every single shift, nurses communicate with patients, with families, with doctors, with other nurses, and even with themselves. If communication fails, care fails. Think about it. We're the link between a doctor's order and the patient's outcome. We are the patient's first line of defense and their primary advocate. When that line of communication breaks, the safety net is gone. That's why mastering this is non-negotiable. Let's start with the most obvious one: verbal communication. This is spoken communication. As nurses, we use it all the time when we're explaining procedures, giving instructions to patients, or reporting critical patient conditions to a doctor. But here is the key that many people miss. How you speak matters just as much as what you say. Your tone, your clarity, and your confidence can completely change how seriously that information is taken. A hesitant voice can make a doctor question your assessment, while a clear, firm voice commands attention in a crisis. It's the difference between being heard and being ignored. Now, let's talk about the communication that never uses words. Nonverbal communication. This includes your facial expressions, your eye contact, your body posture, and even your use of touch. Patients often trust what they see far more than what they hear. A calm posture can reduce a patient's anxiety before a painful procedure. Poor eye contact can instantly destroy trust, making a patient feel like we hiding something or that we not confident in what you redoing. Your body is speaking, even when your mouth is silent. Are you showing confidence and compassion, or are you signaling stress and uncertainty? Next up is written and electronic communication. This includes our nursing notes, our care plans, and incident reports. There's a golden rule in healthcare. If it's not documented legally, it didn't happen. Your notes are a legal record of the care you provided, but it goes beyond that. Electronic health records, charts, and reports keep care continuous. An error entered into a chart can follow a patient for days, leading to incorrect treatments or misdiagnoses. In written and electronic communication, accuracy is absolutely non-negotiable. It's a permanent record of your professionalism and attention to detail. Now this is where nursing becomes truly human. Let's talk about therapeutic communication. This is intentional communication used specifically to support healing. It includes skills like active listening, showing empathy, and asking open-ended questions. This is how nurses help patients feel heard, safe, and respected during some of the most vulnerable moments of their lives. Therapeutic communication is not about fixing someone's emotions. You can't do that. It's about supporting them, validating their feelings, and creating a space where they can be honest about their fears and concerns. It is the heart of compassionate care. Okay, now pay close attention. This part separates safe nurses from dangerous ones. Let's talk about communication styles. First, passive communication. This is when a nurse stays quiet, avoids conflict, or hesitates to speak up. You might hear something like, "I'm not sure." Maybe it's okay. In a social setting, this might be fine. But in nursing, passive communication can delay critical care, and any delay can be deadly. If you see something wrong and you stay silent, you are failing your patient. Next is aggressive communication. This is hostile, blaming, or disrespectful. An example would be shouting, "You never listen. This is your fault." Aggressive communication completely destroys teamwork and trust. It creates a toxic environment where people are afraid to speak up, leading to more errors. No one wins, and the patient is the one who ultimately suffers. It has no place in a professional healthcare setting. Then there's passive-aggressive communication. This is that indirect anger often disguised as politeness. You might hear a nurse say, "Fine, I'll do it since no one else will," with a sigh. This style creates confusion, resentment, and a breakdown in team morale. It avoids direct conflict but poisons the atmosphere, making collaboration nearly impossible. It solves nothing and only makes the problem worse. This leads us to the gold standard: assertive communication. This is the single most important style in all of nursing. Assertive communication is clear, it's confident, it's respectful, and it's always patient-centered. It's not about being loud. It's about being clear. Here's a perfect example. Doctor, this patient's blood pressure is dropping rapidly. I am concerned about a potential hemorrhage and recommend you come and review them immediately. There's no shouting. There's no fear. There's no hesitation. It's a direct statement of fact, concern, and recommendation. This style protects patients, and it protects you as a nurse. Mastering this is a career-long journey, but it is the most important one you will take. Remember, nurses don't work alone. We are part of a massive team. This is where interprofessional communication comes in. This is the constant dialogue happening between nurses, doctors, pharmacists, physical therapists, and everyone else involved in a patient's care. Clear communication between all these professionals prevents medication errors. It prevents duplicate treatments, and it avoids dangerous delays in care. We also use formal communication, especially during critical moments like shift handovers, incident reports, or case discussions. Here, structure is everything. Having a standardized way to pass on information ensures that nothing gets missed. To help with this, we have powerful tools like SPAR communication. SBAR is a structured framework that nurses use to communicate critical information quickly and clearly. It stands for situation, background, assessment, and recommendation. It keeps the information short, to the point, and highly effective, especially in urgent situations. When a doctor gives an order, the nurse repeats it back to confirm they understood it correctly. For example, give 50 of fentanyl. The nurse replies, giving 50 of fentanyl. This simple act prevents fatal misunderstandings when stakes are at their highest. So let's bring it all together. In nursing, communication is not optional. It is not something based on your personality. It is a core professional responsibility and a critical safety skill. Assertive communication, combined with structured tools like SBAR and closed-loop communication, literally saves lives every single day. If you remember one thing from this entire video, let it be this. Speak up clearly, professionally, and without fear whenever a patient's safety is at risk. If you're a nursing student, a new nurse, or any caregiver, please share this video. Better communication means safer patients for everyone. Subscribe for more real-world nursing education that actually matters. Thanks for watching.